Hi everybody, my name is Mitchell Farmer and this is MSK Lab 7 covering the axilla and brachial plexus. So off the start, I'm going to start off with the axillary artery, its branches, and how we define the various parts of the axillary artery. So it begins at the inferior border of the first rib, where the subclavian changes its name to the axillary artery. So essentially we have the first rib highlighted here, and as you cross that inferior border, it's going to change its name from subclavian, left subclavian, to the axillary artery. And similarly, as it crosses over teres major, it's going to change its name from axillary artery to the brachial artery. Okay? So they're kind of continuous with each other, but we give them different names as they enter different anatomical contexts. So the axillary artery is divided into three parts by the pectoralis major muscle. That's not super well shown in this, so instead I'm going to kind of delineate those three parts, drawing out the pectoralis major, a very rough version of it. Essentially coming along here, attaching to these ribs, and coming back up here. Okay? So that's my drawn in pectoralis major. And don't worry, it doesn't have to be nice for you to understand what I'm talking about. Basically, the three parts are from the inferior border of the first rib to pectoralis major is part 1. And there's only one artery within part 1, and that's this one. Okay? That's the superior thoracic, and I will discuss that in a moment. I'm just going to go over the parts right now. Part 2 has two arteries. So part 1 has one artery, part 2 has two arteries, and those are the two arteries lying deep to pectoralis major, or just barely on its edge. One right here, and one right here. And that's going to be the thoracoacromial artery and the lateral thoracic artery. Part 3 is the portion of the axillary artery that's distal to pectoralis minor. So that's going to include the three branches: the anterior circumflex, the posterior circumflex, and then this guy over here, the subscapular artery. Okay? So that's kind of the layout, and that divides us into part 2, part 3, all the way to teres major, and then part 1 up here from this boundary to, or from the inferior boundary of the first rib. Okay, so I know that's pretty messy, but that's how we're going to divide it up as we move forward here. Now on to discussing the actual arteries. So as I said, part 1, I'm going to get rid of the clavicle too. Part 1 has one artery that comes off of it, and that is the superior thoracic artery, which supplies the upper anterior thoracic wall. Part 2, along the medial edge of pectoralis minor, you have the thoracoacromial artery. This quickly divides, it might not even have a trunk, but it quickly divides into three branches, one of which isn't present in this model. There's the clavicular branch, not present, but then there's the there's the acromial branch, which has the deltoid artery, which supplies the deltoid, and then there's the pectoral branch, which helps supply pectoralis major and minor. The second artery in part 2 is the lateral thoracic, which supplies the lateral portion of the thoracic wall, including the breast. Okay? And then finally, the third part has three arteries. It has first the subscapular artery. So the subscapular artery quickly divides into a couple arteries. It divides into the circumflex scapular at the inferior boundary of the subscapular muscle, highlighted here. So the circumflex scapular, which travels posteriorly deep to the triangular space. So we've discussed the triangular space right here, and deep to it is the circumflex scapular artery highlighted there. And that goes on to form the scapular anastomoses. So we have the circumflex scapular, one of the branches of the subscapular, which is one of the branches of the third portion of the axillary artery. The second branch is the thoracodorsal artery. Okay? Now, the next two branches of the third segment that we're concerned with are the posterior circumflexumoral and the anterior circumflexumoral. Now, the posterior circumflexumoral is of particular interest because it's at risk of being damaged in the event of damage to the surgical neck of the humerus. Also, it's at risk of being damaged during dislocation. So, dislocation of the humerus of the shoulder joint typically dislocates backwards, so posteriorly. And so you're more likely to damage the posterior circumflex artery than, say, the anterior. Now, the posterior circumflex enters the posterior area or posterior compartment through the quadrangular space, which I have defined the borders previously. Okay? And then, as I said, beyond the third segment, you have the brachial artery, which supplies the anterior compartment of the arm, which includes biceps brachii, coracobrachialis, and brachialis, all of which I'll discuss next lab. And then there is, if I rotate posteriorly, there is the profunda brachii, or the deep brachial artery, which supplies the posterior compartment of the arm, basically the triceps, long head, or the three heads of the triceps. Okay? So that's the axillary artery in a nutshell. Let's move on to the brachial plexus, which is always hard for people to kind of grasp. And so because of that, I'm going to do things a little differently. I'm going to take this and I'm going to compress it onto one side of my screen if it behaves. Okay? Then I'm going to bring over a diagram that will hopefully let us grasp what's going on with the brachial plexus a bit easier. All right? So, zooming in, we are looking at this segment of this diagram, okay? The roots. So we have C5, move this out of the way, C5, C6, C7, C8, and T1. Those are the roots. Those go on to form trunks. So there is the upper trunk, or the superior trunk, the middle, and the inferior trunk. The upper trunk, as you can see, is a combination of C5 and C6. So C5, C6 come together to form the upper trunk. The middle is formed entirely by C7. And then the lower is a combination of C8 and T1. All right? So upper, middle, lower. Now, each one of those gives off an anterior and a posterior division of it. So each one is going to have it's going to split into two things. The upper is going to join with the middle anterior. So the upper gives off the anterior, and then the middle gives off the anterior, and that forms the, that'll go on to form the lateral cord. But the middle just gives off an anterior that continues off like itself. So you can see that here. You have this V-shaped structure here, which is what we're looking at here. And then we have this black line down here, which is a continuation of the inferior trunk, okay? Not the middle, sorry, I said the middle earlier. The inferior trunk. The middle joins with the upper. Then all of them give off a posterior that all combine together posterior to the axillary artery. So if I rotate around, you can kind of see this like trident here. That is all three posterior cords coming together, or sorry, posterior divisions coming together to form the posterior cord. The posterior cord is so named because it's posterior to the axillary artery highlighted here. So here's the posterior cord formed by the divisions of the superior, middle, and inferior trunks. If I rotate back anteriorly, we can see we also have a lateral cord and a medial cord. These are also named relative to the position of the axillary artery. So medial to the axillary artery is the medial cord. Lateral to it is the lateral cord. As you can see, the lateral cord is formed by the divisions of this, or the anterior divisions of the superior and middle trunk, whereas the medial cord is formed by the anterior division of just the inferior trunk. Okay? So before I get into the more confusing branches part of things, I wanted to really quickly cover the axillary artery mostly so I can get it out of the way because it kind of messes up the picture. So the axillary artery, if I rotate posteriorly, it enters the posterior aspect of the arm via the quadrangular space highlighted right here. And it's formed by contributions from exclusively from the posterior cord. So you have the posterior cord here, and then it splits into two branches, the axillary artery and the axillary nerve and the radial nerve. So I'm going to hide the axillary nerve. Just keep in mind that it wraps around the humerus here, and so it can be damaged, and it innervates the deltoid as well as the patch of skin just above the deltoid. So if you have numbness in that kind of badge area, it's called, there might be damage to the axillary artery. So I'm going to hide that. All right, moving back anteriorly. So a thing that's often talked about regarding the brachial plexus is the M, so to speak. So the M is a structure formed by the creation of the musculocutaneous, the median, and the ulnar nerve. So here it is. Musculocutaneous, median, ulnar. And you can actually see it really well right here. So that's the M that you want to look for when you're trying to differentiate those structures, okay? The median is in the middle. The musculocutaneous is going to be the most superior and lateral. And then finally, the ulnar is going to be the most medial and inferior. All right? So you can kind of see how that's formed. So I'm going to take this and move it back over here. I'm going to put this back to encompass the whole screen and over here. So I guess a quick review before I go over roots and stuff like that. Basically, you have roots C5 through T1. Those give off, or those combine to form trunks, the upper, middle, and lower trunk. Each trunk gives off an anterior and posterior division. There's two anterior segments, so one here and one here, and then a single posterior where all of them come in together. The posterior continues, the posterior divisions combine and continue as the posterior cord, which will eventually give off both the axillary and radial branches. The anterior, the upper anterior divisions continue to form the lateral cord, whereas the lower continue to form the medial cord. The lateral and medial cord create that M that's often talked about, consisting of the median nerve, the ulnar nerve, and the musculocutaneous nerve. All right? So, the final thing I wanted to quickly discuss is what are the nerve roots of these muscles. So musculocutaneous is C5 to C7, and it's going to innervate the anterior compartment of the arm. As far as what everything innervates, I'm going to try and discuss it a bit here, but I'll be talking about it throughout the time on next lab's videos when I'm discussing the actual muscles of the arm, all right? So musculocutaneous, C5 to C7. I'm going to hide it. The median is C6 to T1, and it's going to lie on the anterior aspect of the axillary and brachial artery as it descends inferiorly or distally. I'm going to hide that. And then there is the ulnar, which is C8 to T1. And the ulnar, actually I won't discuss that now. I'll discuss that next lab. And I'm going to hide that as well. Okay. And then finally there's the radial nerve. It's going to innervate the entire posterior compartment of the arm and forearm. All right. So I'll hide that then. So that is the brachial plexus in a nutshell. It's tough to follow. The anatomy is going to be hard to delineate when you're covering it in the cadaveric dissection, but that's the best I could do for this video. The last thing I wanted to cover is just a couple muscles that haven't been covered too much in the previous videos on the shoulder girdle. And that is, one sec, I'm just going to bring up that view. All right, there we go. Let's bring up that view. And that is the serratus anterior, seen here. So the serratus anterior holds the scapula against the chest, forming what I guess in quotations could be known as the scapulothoracic joint. It's not a true joint, but it's basically the articulation between the scapula and the whole thoracic area, or the part that it actually articulates with. The movement of the serratus anterior is kind of like reaching out to touch someone. It's known as protraction, but the best way to think about it is kind of reaching out to touch someone. But I'm just going to show you like this. See how it's kind of extending forward like that? Here it's called scapular abduction, also known as protraction. And it's kind of reaching out to touch someone. That's what the serratus anterior does. Okay? And so that's the last muscle I just wanted to cover, just for the sake of thoroughness. And I hope you enjoyed the lecture on the axillary artery and the brachial plexus. Okay, I will see you for laboratory 8.